Maayong adlaw natong tanan. In this video, I'm going to show you exercises while observing the sternal precautions after you had your open heart surgery or your coronary artery bypass grafting. Hi, I'm Nathan. I'm your occupational therapist. My goal is to help you be more consistent with your therapy at home. Yes, it is still very important to do exercises after you had your open heart surgery. While observing sternal precautions, exercises can still be done, okay? So there are a few exercises that I recommend. So the first exercise is breathing exercises. For this exercise, we're going to use a straw to give us a little bit more resistance through the exhalation part. Okay, so we're still breathing through our nose and then breathing out through the straw. All right, so let's get started. Let's do 10 deep breaths. In through the nose, and then blow. In through the nose, and blow. So that's deep breathing using a straw. Next, neck rotations or head rotations, okay? So let's do 5 this way and then 5 this way, okay? All right, go. 1, 2, 3, 4, 5. Now let's go the opposite direction. 1, 2, 3, 4, 5. Make sure you're not dizzy. That's neck rotations. Next, shoulder shrugs. So let's just bring our shoulders as close as you can to your ears. So like this. Okay? Easy. So let's do 10 again. All right? And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's shoulder shrugs. This is the fourth exercise, shoulder circles. So in this type of shoulder circles, we don't want to be opening wide like this because that is part of the sternal precautions. So we're just going to bend our elbows, try to touch your shoulders as much as you can. And if you can't, it's fine. Just bend your elbows, okay? And then you're going to draw circles with your elbows. All right? So let's do 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That is shoulder circles. Number 5 is trunk rotations. So the easiest way to do this while observing sternal precautions is to put our arms across our chest like that, and you just go side to side like this, okay? So trunk rotations, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Trunk rotations. Next exercise is hip rotations or the hula hoop. Okay? So we're just going to do 5 this way and then 5 that way. Okay? So 1, 2, 3, 4, 5. All right, next. Go the opposite direction. 1, 2, 3, 4, 5. So that's hip rotations. All right, we are now in the 7th exercise, but remember to pace yourself and to be mindful on how you feel. If you are short of breath or you're already exhausted, please take a break. And then you can do the rest of the exercises in the afternoon or when you are ready to do more, okay? So the next exercise is biceps curls. Remember, do not lift more than a half of a gallon of milk, okay? So that is your basis. This is your guide. Nothing heavier than a half a gallon of milk. So, for the biceps curls, we are going to just use water bottles. Yes, it is still full. Don't use an empty water bottle. Alright, so you can still use this. You can still use water bottles as your resistance or as your weights. Alright, so it's just bending your elbow, biceps curls. You're not going to put any strain on the surgical site with biceps curls, okay? So, bending elbows like that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's biceps curls. Next one is shoulder flexions or just shoulder raises like this. Again, do not go over the shoulder. Okay? Just right there. Slightly below shoulder level. Okay? You can still do this. Light weights. Water bottle weights. Okay? So, shoulder flexions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Just shoulder flexions. Okay, now we are on the 9th exercise. Again, if you need to take a break, take a break. Rest, sit down, okay? Catch your breath. Please be patient with your recovery. You need to take care of that surgical site, okay? Cannot emphasize that enough. All right, next one is triceps extension. So what you want to do now is to bend slightly forward. Make sure your back is still straight. Don't go hunching like this. Keep your back straight, bend slightly forward, and you're just going to keep your arm parallel to your body. So like that. That is triceps extensions. Let's do 10 of those. Okay, slightly bent forward. Keep your arm parallel to your body and this way. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That is triceps extensions. Next, we're going to sit down finally, right? So we're going to exercise our legs and our core at the same time in this next 3 exercises. Okay, so hold on to your chair. You're going to bring both knees up and down. Let's do 10 of those. Okay, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's knees to chest. Next is air bike. So just lean slightly backwards. Still hold on to your chair. We're doing the air bike. Again, this targets your core and your legs at the same time. So double whammy. All right, let's do it. Air bike. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That is the air bike. All right. Last core exercise is going to be the scissors. Still sitting down, we're going to open and close our legs. But keep your legs straight. Let me back up a little bit here so you can see. So, like this. Okay? So, we're going to do 10 scissors. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that's the leg scissors. Okay, so this is the last one. Again, you don't have to do all these exercises at once. Please take frequent breaks. This is the last one and this might be the hardest one. So, again, get your pillow, the pillow that the hospital gave you upon discharging you from the hospital. Use it. It might be in the shape of a heart or sometimes a teddy bear if you're lucky. So, put the pillow against your chest and we're going to do sit to stands like this. So we gotta practice that. Everybody needs to practice sit to stands, okay? Let's do just 10. Now if you cannot make 10, just do how many that you can, but rest afterwards if you feel exhausted already, because this will really take your breath away. All right? All right, let's start. And 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. That is your sit to stands. Whew! That is it, guys. Those are the exercises that I would recommend you do after your open heart surgery. Okay, so yes, you can still do your exercises. Ask your doctor how much activity you are allowed to do, but please do not forget to do your exercises. Again, stop when you are short of breath or when you feel exhausted already. Take a break. You don't have to do the exercise, all the exercises that I showed you today. Just break them down. If you can only do 3 types of exercises for that day, just do those. Then the next day, all right? Do more the next day, or just feel your body. Make sure that you are observing all the sternal precautions too, okay? So if you find this video helpful, please click on that subscribe button. That will help me with the YouTube algorithm, and share this to your family or your friends who might need therapy after they had their open heart surgery. But mind you, you can still do these exercises even if you did not have the open heart surgery. You can continue doing these exercises. This is not exclusive for patients with open heart surgery, okay? But these are what I recommend after you had your open heart surgery, okay? So until next time, paalam.